Hello. Um, Today I got a question from a friend of mine about. Sorry, I cannot really face the camera, so I'll have to be facing the video. It makes me focus more. So I got a question from a friend about blood in the urine of a cat. So I'm pretty sure that this is like kind of old information for lots of veterinarians. But for people who are, I mean, might be new veterinarians or who are preparing for the national board exam or maybe just graduated, I'm going to try to put that thing together. So we'll go with the case, I guess, from the phone call, and I'll try to analyze what do I think of what the plan is depending on the phone call. So, Mr. Klein calls and says, "Well, hello, my name is so and I have a cat, and I've been noticing blood in the urine. First, that's an alarm, okay? This case might be an emergency, it might not. So I need to not alarm the client, because if you alarm the client and then you later on find out that it's not an emergency, then they'll say, well, he was just trying to make money of me. So yeah, forget that. You just think to yourself, well, that might be an emergency. So first thing that you need to know over the phone is you need to ask, well, is the cat eating? That's very important. It's a very basic question. It's very important. Cats that are not eating, that are sick, might have a urinary obstruction. That's what we're trying to find out, and we'll get to that in a minute. But the first question to ask is the cat eating? Because it's very hard to ask this one, well, is the cat sick? Is the cat eating? If the cat's not eating, then the cat is sick. So, now, let's say he says that, well, the cat is not eating. So we're going to need to see the cat. Second question is most important, is to ask two things. Is the cat a male or a female? That's very important. Females do not really get urinary obstruction. Three reasons. I don't know if you need to know that, but there are three reasons why they don't get the urinary obstruction. One, they have a shorter urethra. Okay, so shorter urethra. If there is a stone, it's easier for it to get out of the urethra because it's short. Whereas if the urethra is long, then the muscle contraction of the urethra is going to need to propagate, move the stone forward for a long distance. That actually would never allow the stone to get out if it's a big stone. But if it's a shorter urethra, then just a couple of contractions and the stone is out. So shorter. One thing, that's one thing. The other thing is it's a wider urethra. It's a bigger urethra because the urethra like tapers. It starts big and gets small. The longer the distance is, the smaller the tube is. In a female urethra, it's shorter and it's wider, so it can get the stones out. And then finally, the most critical thing is the female urethra is short, wide, and straight. It doesn't have any turns. But the male urethra has a turn, and that turn is usually where the stones would lodge. But another thing is where the urine will slow down when it's coming out. So when the urine gets through the turn, then its force will slow down, and that reduces its ability, the urine, when it's coming out, to kick out the stones. So females usually do not get obstructed. I haven't seen an obstructed female in my life. I'm pretty sure that there are some, maybe, but I've never seen one. But the most important one is the male. So you need to ask first, client calls, blood in the urine, is the cat eating? That's the first thing. Cat's not eating, we need to see the cat. Well, cat is eating, we still need to see the cat. But if the cat is not eating, we need to see it pretty soon. Because the changes once there's an obstruction are instantaneous. The cat is not critical now, will be maybe critical in an hour or two, so we need to see him right now. Also, when you're thinking, when you're on the phone, you need to give your time to do the work, because if you get the cat, find out that it's obstructed and you're near closing, then you're going to need to send it to an emergency. The client might be upset. because you couldn't finish the work. You need to kind of like stabilize the cat, and once you've placed the urinary catheter, then you can talk to him about like aftercare. Now we need to refer him to an emergency clinic, but right now he would be stable and you can drive him and you're fine. But you need to get him out of the emergency situation. So you need to see the cat as soon as you can so that you have time to do diagnostics, find out if he's obstructed or not, and then refer him. But back to the main scenario. He called us and now we find out if it's a male or a female. Now let's say it's a male, okay? The other thing that you need to know over the phone, again, my opinion, that helps you, yes, you might be surprised and you might get a cat that's obstructed for the first time when he's 9 years old, but that's not common. Most of the cats that are obstructed are young cats. Year and a half to maximum 3 years is the first time that the cat is obstructed. Well, if the cat has been obstructed before, then the owner would be more receptive to your treatment plan, because it's going to be expensive, but they know that the cat has been obstructed and they've gone through that before and they know how expensive it is. So they don't get surprised, they're usually easier to deal with. But if you get a new cat, a younger cat, the cat might be obstructed for the first time. That cat you need some finesse in handling the client. So let's go back. Younger cats are likely to be obstructed more than older cats. Why? Kidneys over time, as the cat ages, gets weaker. They're not performing their function as they once did. And when the kidney is not doing its function well, the first thing is loss of concentration ability. Concentration ability deteriorates over time. So I will have dilute urine. If the urine is dilute, then the chances of the stones forming or the crystals forming to form the stones is really low. If the urine is concentrated, then obviously there's more content to it, there's more crystals, and then you can have more stones. So we try to dilute the urine to avoid the crystals forming. If the cat is old, the cat's urine is dilute as it is in many cases. Some cats have very concentrated urine at 12 years of age, which means that they have a very good kidney function, but that can lead to the stone formation. So if you get the call, again, he tells you the cat is 9, well, chances are the cat is not obstructed. We're not going to bet on that because we can't make a mistake in that decision. If the cat is obstructed or not, we're still going to recommend seeing the cat right away if it's a male that's having blood in the urine. But if it's an older cat, at the back of my mind, I think probably it's not obstructed, especially if it hasn't been obstructed before. Because if it has not been obstructed when it was young, why would it get obstructed when it's older? But if it's a younger cat, then by contrast, I would think, well, yeah, that cat might be obstructed. So, okay, so Mr. Khan bring the cat in. We're going to say that, well, what we want to make sure of is that we want to make sure that your cat is not obstructed. One thing to know is the client will say also, usually with seeing blood in the urine, is that the cat has been going to the litter box every couple of minutes. People, when I was new, I would hear that and think, well, yes, that's obstructed. No, it's not. Not necessarily. Why? Because what causes the obstruction, the disease that would cause the obstruction, will cause the cat to go to the litter box every couple of minutes. And the obstruction will cause the cat to also get into the litter box every couple of minutes. So the cat might have the blood in the urine, which might lead to obstruction, but it's not obstructed yet. Okay? So him frequenting the urine box does not tell you. What does tell you? Again, what I said before. Is he eating? If he's eating, then he is not likely to be obstructed. If he's not eating, then he might have urinary obstruction because they get sick. So we're going to bring the cat. Okay, so what do we do when we get the cat? When we get the cat, and that's important to tell the client over the phone, we'll probably, sir, going to need to run blood work. Why? When you run blood work, you would know if the cat is obstructed or not, because that's a decision that's hard to make. We'll get to that in a minute. If you find the kidney values elevated, which we call azotemia. Azotemia means that the kidney values are elevated, BUN and creatinine are elevated. If you find the cat is azotemic, that makes it likely that the cat is obstructed. Another thing that you need to do with the BUN and creatinine, if they're elevated, is you need to tell the client the prognosis, okay? Because they always worry about the prognosis. Prognosis is what is the expected outcome of the case. If I have a cat who has a BUN of 120 and a creatinine of 10, I need to tell the client, so anything above 2 is getting into the abnormal range. Anything above 3 is definitely abnormal, okay? So if you have a cat that has a creatinine of 10, that's pretty high, but then you would need to tell the client, well, okay, so his creatinine is 10, sir. When we unobstruct him, there is a chance that his kidneys will not regain its full function. Well, how do we know? Well, we will need to put him on IV fluids for 24 hours, and the response to the fluids in 24 hours is what determines the prognosis, the expected outcome of the kidney, not how high it is. So if it's 10, I put him on fluids 24 hours, it's 5, we're fine. We'll continue another 24 hours, so in 48 hours maybe he'll get back to normal. But if it's 6, and I put it on fluids for 24 hours, and now it's 5.5, no, that's not likely. So it's the delta, it's the amount of change in the creatinine in response to the fluid therapy that gives us that prognosis. But if you have elevated kidney values, we're going to need to diurese this cat. Diuresis means that we give them fluid to get it out. One thing that's really important to remember is that when you're using shock dose in the cat, if you're going to give them lots of fluid, you could do that. We'll get to that in a minute. Is that the shock dose in the cat is half that of the dog, the blood volume they call it. So the blood volume in the dog is 90 ml per kilogram, and the shock dose in the cat is 50 ml per kilogram, right? So be careful with that, because if you give the cats fluids at a very high rate, then they can end up with pleural effusion. They just dump it in their chest, which will cause a respiratory crisis, and that's going to be a problem. So back to what we were saying. So that's why you need to run the blood work. It's very important for you to find out if the kidney values are elevated for 2 reasons. One, if the kidney values are normal, the chances of the cat being obstructed is not that high. It still could happen, he just got obstructed, but he hasn't been obstructed for long. That's one thing. So that helps you answer that big question: is this cat obstructed or not? Does it need me to anesthetize him and unobstruct him or not? Okay? So that's the first question that's answered by the blood work. If the kidney values are elevated, chances are he is obstructed. The second thing is, it also lets me know before I start like anesthetizing the cat and have the client pay money, how bad this case is, and more importantly, what do I need to do to find out what that case is? Because what I will need to do is I'm going to need to put the cat on fluids for 24 hours. You, again, will be, I guess, pretty shocked or surprised by how many times that happens. The client will track back what you said and say, well, had you told me before you unobstructed him for $600 that he would need to stay in the hospital for 24 hours and that he might not improve, I might have made the decision not to pursue that treatment. And the idea, the thinking will be, well, you held this information in order to affect my decision and make me pay you the money so that you would do a procedure that you know might not work. Okay, so you need to be clear about that. Sir, with these high values, we need to unobstruct the cat, but he will need to stay in the hospital for 24 hours at least after that. That's going to cost that much. Okay, that's really important. So Now we're done. We got the cat. We ran the blood work, and let's say if the values are elevated, then anesthetize the cat. You can feel the bladder; it's big. You can take X-rays. Not the best thing. Ultrasound is way better, but I think not everyone has an ultrasound. But yeah, by the way, we have ultrasound. That's the first thing to do. First thing to do before anything. You get that cat, put it on the V-shaped trough and reach the probe in there. Very easy, not painful, and you need to do the first thing first, because if the cat is gonna like try to growl and scratch you and stuff like that because they're in pain and they can be acting up. If they're acting up, they have a very short tolerance. If I have the tolerance of the cat at like a minute or 30 seconds, what I need to do is get the probe on the bladder and see if that bladder is obstructed or not. I'll discuss the difference in a minute. But that's the first thing to do. We'll do the ultrasound. Then I would collect the blood sample. Then I would feel the bladder of the cat. Okay. You need to let the client know. We'll collect the blood because again, the blood is, you need the cat to be stable. You need the cat to stay for some time to do the blood. So do the things that you have to do and the cat has to stay for first, and then you can do the other things later. For example, if you want to mask the cat, well, the cat doesn't have to stay. He's going to struggle, you're going to mask him. So you don't need to do that the first thing. If you want to give him an IM injection, you don't need to do that the first thing. That's easy to do. Even if the cat's really angry, you're going to throw a towel and hold him, you're going to give him the injection. But there are things that you can't do while the cat is struggling. You can't really draw the blood well if the cat is struggling. So once the cat gets angry because it's in pain and you're handling it, you're not going to be able to do these things. So you need to prioritize what you're going to do. Ultrasound on the bladder, then the blood sample. And then after that, I would run the blood in-house. We're looking for the azotemia, and what else are we looking for? We're looking for potassium. Potassium is very, very, very important. One of the things that I was telling my friend who called me in the morning is, again, through the years, I've been a veterinarian for like 12 years. Through the years, I have some key information that I remember, and I don't remember the rest. Okay, because the key information is what helps me. It's what helped me pass the national board exam, but it's what helped me make everyday decision. I just remember the big lines. Okay, the headlines. One of these headlines is potassium is the main intracellular ion. Okay, so in the cells you have lots of potassium. Outside of the cells you don't have lots of potassium. You have lots of sodium running in the blood. Okay, so the blood, you can look at the blood values. I mean, if you got I think the critical number for potassium is like 6. If it's in the 7s, it's high. But the other one, the sodium, is like 154. It's above. If it's 160, then it's high. I haven't checked. I don't have blood work in front of me, but yeah, it's single digits, triple digits. Okay, single digits for potassium. It's one number, like below 10, definitely. Say yes, below 7. Normal for sodium is below 154, which is like triple digits. So that's important to remember. I'm going to say why. And the other thing is potassium, sodium is rich in potassium. How do we know that? The way I remember that to myself is that there is something called potassium sparing, like potassium saving, okay? Potassium sparing diuretics, like spironolactone. So when somebody tells me that, well, there is something called potassium sparing or saving potassium sparing diuretic, what I remember is, well, that means that normally the diuretic would not spare the potassium, it would dump it in the urine. So that makes me remember that, well, urine is usually rich in potassium. It has lots of potassium. Now, one other thing that you need to know about potassium is potassium used to be used for execution. Um, the lethal shot used to be potassium at some point. So high concentrations of potassium are fatal. They use it for execution. Used to use it for execution. So if we have high potassium, we need to let the owner know of the risk of the anesthesia. Okay? So what do you do if you have elevated potassium? Again, there's a test question and there is a not so much test question. So what do I need to do to dilute, to reduce the urine? Well, one, you can give fluids, especially if you give sodium chloride, 0.9, normal saline. You get the catheter in, put the catheter fluid. You're going to dilute everything in the blood. Everything in the blood is going to go down. Okay, so you're going to get the potassium down. Okay? You can also use lactated ringers if you don't have sodium chloride. If you have sodium chloride, use it. If you don't have sodium chloride, then use lactated ringers, because the concentration of the the potassium in the lactated ring is going to be way less than what you have in the blood. Okay, so look. Now, the other thing is there is a table available in all critical care books, available in VAN. If you don't have it, just text me and I'll or email me or whatever way to reach me, and I'll give you the table. The table is very well known as what to do at each level of potassium. So what I'm talking about is diluting the potassium, probably talking about like 6 point something or 7. Fluids would work. A little bit higher than that, well, we're going to start using glucose, and when we give the glucose, then the body will respond by secreting insulin. Insulin will take the potassium inside of the cell. So insulin takes the potassium with the sugar inside of the cell and dump the sodium out. So that's another key information to remember. What does the insulin do? Well, the insulin does sugar in, sodium out. Sodium is the antagonist of potassium. Okay? So sodium is outside of the cells, potassium is inside of the cells. What does the insulin do? Insulin will get the glucose inside of the cell and the sodium out of the cell. So that's the main function to remember about the insulin. But then, well, because it's getting potassium out, it's going to get sodium. It's getting the sodium out, it's going to get potassium in for balance. Okay, so that have the acid-base balance, because both are positively charged. But again, if that's too much information, again, I'm trying to put as much information for the national board exam, because again, these key concepts are what I remember. I don't remember all the physiology, just intracellular, extracellular, positively charged, negatively charged, and so on. So let's go back. If I give the fluids just in ACL, that will reduce it. Again, if you don't have it, just use LRS. We're talking about like 6 or 7. If we're higher than that, we might need to use glucose. Well, if we're higher than that, then we're going to use the glucose, the dextrose, 5% with the insulin. We give both, because when we're giving insulin from like exogenous source, then it will reduce the potassium as well. Cat is usually stressed and the insulin is up. The blood sugar is usually up. So you kind of don't need to worry about that, especially if you're giving glucose well. And you're going to see that on lab work as well. So fluids, glucose by itself, glucose plus insulin, and then third, you would use sodium bicarb. You would give bicarb. Again, we're talking about most clinics. I don't know if they have that, if they practice, but if you're in an emergency setting or apparently. I mean, obviously, if you're an international board where everything is available, so you would be using sodium bicarb. Why does that work? Well, again, sodium bicarb is going to need to be neutralized, and the way the body neutralizes that is by taking it in and getting the potassium out. So it takes sodium, the bicarb in, gets the potassium out. So just use bicarb. The fourth thing, which is I think that's really high potassium, or 10 or something, is you're going to use calcium. Okay, you give calcium IV because calcium has like a protective effect on the heart against the potassium. So the potassium increases the heart rate, the calcium does it down. One of the ways I remember that again is if you've got a cow with milk fever, which means that she has low calcium, like having tetanus kind of signs, then we're going to give her calcium IV and we listen to the heart. If you find a dropped beat, that's you've given too much calcium. Stop. Okay, so that reminds me, heart rate drops, calcium. How do I remember it? We're listening to the cow's heart who has milk fever because she's dumping all her calcium in the milk. And that also ties in with remembering what the case is with elevated potassium, is where we're going to give calcium for protective effect. Again, how much calcium to give and how fast is available in that table of how to deal with hyperkalemia that's available in all the critical care books. So these are the things that we'll need to do. Also, we're going to, more importantly for me, you're going to need to call the client to let him know potassium is high, increases my anesthetic risk. Okay? You're going to need to hook the cat on an ECG to see what kind of ECG you have. Probably at least get a heart rate, and then you see. I think that the arrhythmia is atrial fibrillation. I'm not really sure. I'll need to recheck on that. So now let's say that we have gotten the cat, and the cat is got. I'm gonna first get to if it's normal, if the azotemia is normal, if I don't have any elevation in the kidney values. Everything is cold blood work. There's nothing there. So the question would be, well, is it about to be obstructed? I can determine that usually, in my opinion, by imaging. I don't depend on pushing, because if you try to push the bladder, I mean, people, I guess some people worry about rupturing it. I think that's pretty hard to do, because if the bladder is about to rupture, the cat is not going to allow you to press on it till it ruptures. The cat is going to probably do something to you before he would let you do that. The reason I don't depend on it is because the condition that causes the cat to get obstructed is an inflammation in the bladder. It's painful and the wall is bloody. So if you're pressuring on it, the cat, whether it's obstructed or not, because the bladder is sensitive, is not going to allow you to feel. Again, feel the size. Okay, that's one thing. So in my opinion, if the bladder is big, that's a really high suspicion that the cat is either obstructed or about to be obstructed. Why? So I'm going to need to back up a little bit. So how does the cat get obstructed? So we're trying to answer the question of why would the bladder usually be empty if the cat is not obstructed in this presentation of blood in the urine. So what I'm saying is, cat's got blood in the urine, the bladder is either empty or almost empty, or the cat would be obstructed actually. Why is that? So let's trace back. What causes the blood in the urine? The blood in the urine in the cat is caused by something called feline lower urinary tract disease. It's like fluid, but you replace the I in fluid with L. No, you replace it with a T, fluted, okay? Feline lower urinary tract disease. So replace the I in fluid with T and you've got the acronym for the disease. So what happens with that? Happens with that is this is what used to be called sterile cystitis. The cat is stressed, and the stress is usually the most common reason is any change in the environment, meaning that if you just adopted the cat, that's a change in the environment. It came from the shelter to the house. It doesn't matter if it's a better environment. It's a change in the environment. Cat will get stressed. Cortisol levels go up. The bladder will be inflamed. Inflammation means that there's going to be protein and blood, but more importantly, protein poured in the urine that will change the pH of the urine and will make it more alkaline. And when the urine is more alkaline, then the crystals, the strovites, start forming, and there's also mucus blood. I mean, when the bladder is inflamed, just like inflamed nose, you get mucus. Okay, inflamed colon, you get mucus. The inflamed bladder, you still get mucus, and that mucus can form a plug, and that will obstruct the cat. Or the mucus can be mixed with the crystals, which are like sand, and form like a plug, stone, that will obstruct the cat. So the reason the cat gets obstructed is because the bladder is painful and bloody. And guess what that means? Is that's why the cat wants to void all the time. That's why in the beginning I said when the cat wants to void all the time, has urgency, it doesn't necessarily mean that the cat is obstructed. It means it has got the disease that might cause him to be obstructed, but it doesn't mean that it is obstructed. Now urine production is different. If the cat is going there not producing any urine, then he is obstructed. But the thing is, well, because he's voiding all the time, he will be visiting the urine box and he will not be having anything to get out. The cat just wants to get every last drop of urine out because it's so irritating for the urine to touch his bladder because his bladder is inflamed. So, that being said, normally I have a hard time even getting the urine sample because the bladder is empty, because the cat is emptying it all the time because it's irritating it. So, if I have a really big bladder and the cat has got blood in the urine, well, that cat normally, because there's blood in the urine, will have a painful bladder and will be trying to empty it all the time. Again, that's not necessarily the case. Sometimes the blood is there, the cat is not as irritated, the bladder is not that inflamed, but there's pouring some urine. So sometimes that doesn't work, and we still need to evaluate. But what I'm saying is, most likely, if the cat is not obstructed, most likely you're going to find the bladder really empty. Really small, hard to poke. You can see that on ultrasound, looks totally different. Small bladder, really big bladder. And also if the cat is 3 or 4 years old and has been having that disease for some time, you're going to find a very characteristic shape of the bladder. Sometimes you find that really thick wall. Okay, so what I'm saying is, if you find the bladder big in a cat that's got blood in the urine, I would suspect that that cat is obstructed. Even if you have blood work that's normal, well, if the blood work is normal, then the cat is not as high of an anesthetic risk. Anesthetize the cat, express the bladder, make sure it is not obstructed. Don't think, well, it's... I guess don't be hesitant. Err on the side that it is obstructed if you have a big bladder, because in most cases, if the cat is not obstructed and it has the disease that causes the blood in the urine, that means the bladder is irritated, the cat will be voiding all the time. So if I'm repeating myself, I hope that's not boring. But anyway, we'll get back. So we've found out that this cat is got a big bladder and the blood is normal. We're going to anesthetize the cat. Well, what do we use for anesthesia? The protocol that I use Midazolam. Okay. Why Midazolam, not diazepam? Again, I have multiple reasons. One is Midazolam will work for everything diazepam does, and it is given IM. Okay. If it's given IM or sub-Q, then that means that you don't have to get a catheter in. So that's a plus for me. The other thing is, if you do exotics, we're going to be using the midazolam on rabbits. We're going to be using the midazolam on birds. Okay? So why not carry that drug instead of carrying the Valium? It can be not as common to use in rabbits. At least I don't use it in rabbits, because again, you would need to hit a vein in the rabbit, and good luck with that, especially when you're first starting. So just use midazolam, then you got rabbit anesthesia in your practice, which is, I think, pretty good. Why do I use the midazolam? Or in that case, the diazepam would work. Again, both of them do that. Because benzodiazepines are muscle relaxants. Okay, they will relax the muscles of the urethra, and then the stone can get out. Here's another thing, and I thought that was very funny when I first noticed. I mean, I don't know. It's like, oh yeah, right, okay, fine. So diazepam is a cardiac-friendly drug. Well, not the vehicle of diazepam, and I mean, how are we going to inject the diazepam without the vehicle of the diazepam? So the stuff that the diazepam is dissolved in is not cardiac friendly. So if you've got high potassium, that's a problem. If you've got a heart that's already got under stress, it's a problem. Okay. So, but not the same thing is not for midazolam. Okay. Also, because midazolam can be given IV, which can be given IM or sub-Q, then you have the option of giving it sub-Q or IM. And in that case, you're going to have slow absorption. It's not going to have the same effect on the heart as just giving it IV. That is, again, if it has an effect on the heart, but it is a cardiac-friendly drug, as opposed to the vehicle of diazepam. Diazepam itself is cardiac-friendly, but I mean, what use is that if the vehicle of it is not? So that's why I use the midazolam. The other thing that I use buprenorphine. Buprenorphine is very good with pain control in cats. It is not as good with sedation, but coupled with the midazolam, cat smells the mask and sleep in like a minute or so. I forgot what I want to say. Yes, yeah. Butyrophenol, as opposed to, that's another thing for the boards, whatever. The B's go together. Okay? So you can only give butyrophenol with buprenex. Okay, the other, you cannot give them with other morphines, other opioids, because they block the receptors. So the two that can go together is butyrophenol and buprenex. That's one thing to remember. I'm not saying, I mean, to be honest, I don't really know any situation where I would use both, because when you use both, I've done that before, you get very, very immense sedation. But be that